The art of injectables is not how an injection works. That's the science of injectables. The art of injectables is to know when the right time and which injectable is correct for the patient. And I think our nurses have a great foundation in that.
So Val, of the 3 neurotoxins that are available, Xeomin, Dysport, and Botox, which do you have a preference for and where do you like to inject?
I enjoy using all of those neurotoxins. I have the most experience with Botox, so that would be the neurotoxin that I typically would use if a patient came in. I like to use Botox in the forehead and around the eyes and really in all areas of the face. If a patient has had a resistance to Botox previously, then I would go to one of the other neurotoxins, or if they specifically ask to try that neurotoxin, I would have no problem using any of them. Sometimes patients have an event that they're trying to prepare for, and so they would like to have a quicker onset of the product, and Dysport seems to have the quickest onset, so I would try that product if that's what they were looking for.
I would agree. I use more Botox than Dysport or Xeomin, probably just by the nature of the market share, but I have feel that all the 3 products are extremely safe and their efficacy is all very reliably and good. So many times it's just really based on patient preference. In terms of injecting, I think that we have to remind ourselves that Botox has other benefits other than just getting rid of the wrinkles. And when you Botox appropriately in the forehead and out to the outer eye, you can really elevate that lateral eyebrow and really opening up the upper eye, and patients really seem to like that aspect of Botox that we don't always think about.
So we all bring something to the table that is unique. Michelle, what do you think that is the best thing that you provide as a nurse injector?
What I really enjoy about being a nurse injector is building relationships with people and earning their trust. I just think that that's so important, so that when they come back to us, they know that they're in good hands.
I think that educating, each other as well as our patients is a big part of what we do, and we do it very well, so that they get a unique experience with all of us.
We also get to attend every national meeting. We get to keep up with all of the new products, the new techniques. We can always talk to one another about what's new and what's best, and what do we think about this product or that product, or using something in a new way. And I think that it's very important.
So of all the areas that we can inject, do you have a favorite area, and if so, why, and which product do you like to use?
My favorite area to inject are the cheeks. Give the face a lifted quality, and most women love it. The product I like to use there is Sculptra. Sculptra gives a wide range of volumizing. It's a product that lasts for about 2 years and continues to build collagen during that time. How about you?
I agree. I like Sculptra too, but I like to use that in someone who has a lot less volume as a base, but my favorite product for the cheek area is probably Radiesse, and I think it gives a very really nice correction. It builds volume over the cheekbone, and it's immediate, so they can immediately pick up the mirror and sort of see that wow effect of what we've just done. But I also like to inject the lips, and I think one of my favorite products in the lip area is Restylane, because it provides kind of a very consistent volume for a patient that's rather natural. And then, there's other products that are available too. What do you like?
I like Belotero for the perioral lines. And what I like about that product is that it doesn't show blue through the skin, which is called a Tyndall effect. And it gives a very nice correction. So I agree, Restylane's a good product to use around there, but I like Belotero as well.
Belotero is a great product for the lip lines. I also really like to use Belotero in any other fine line on the face, especially these lines that patients get right here from sleeping, even in the crow's feet area and on the forehead. Belotero seems to be a great product for any fine line.
Primary focus in the entire practice, taking care of patients, specific focus, doing the best injectables possible in the appropriate patients at the appropriate time of life.